Good afternoon. On behalf of the Office of Community Engagement at MCW, I would like to welcome you to today's webinar. My name is Sarah O'Connor, and I'm a program manager in the Office of Community Engagement. The purpose of today's webinar is to highlight some pandemic-related shifts that organizations and individuals have made in strategies for communicating and connecting with their partners and the public. We invite you to join the new Interim Senior Associate Dean for Community Engagement, Dr. Stacy Young, and the faculty of the Office of Community Engagement as they share what they have learned from their partnerships and projects over the past year. We will then transition to our quick clips portion of the agenda, which is a unique format that will highlight innovative methods for communicating and connecting during the pandemic. We hope you enjoy it. Please put questions and thoughts in the chat, either to the group or to me privately. For those claiming CME, please fill out the evaluation using the link that will be dropped in the chat. And please note that this session is being recorded. And now it is my pleasure to introduce you to Dr. Stacy Young, our new Interim Senior Associate Dean for Community Engagement. Dr. Young is an associate professor in the Department of Family and Community Medicine and the director of the Center for Healthy Communities and Research. Dr. Young joined MCW as a program coordinator in 1997 and became an MCW faculty member in 2008 with a focus on community engagement. She teaches graduate courses and mentors students for MCW's PhD in Public and Community Health program, and she serves as a faculty advisor for the student-run Saturday Clinic for the Uninsured. Dr. Young has been the principal investigator for multiple research projects with long-standing local and statewide partners, addressing the public and community health workforce and the role of safety net clinics in ensuring access to healthcare for the uninsured. As a medical sociologist, her work demonstrates a deep commitment to examining structural barriers and conditions that contribute to health disparities. She is a co-investigator for NIH-funded studies related to cancer prevention and disparities among racial and ethnic minority women. Dr. Young has led several programs with faith-based organizations to train parish nurses, community health workers, and community advocates. She works in partnership with the Benedict Center, addressing women's exposure to violence, and work to increase access to safe shelter and housing for women in street-based sex work. She serves on the board of directors for the Wisconsin Association of Free and Charitable Clinics and Wisconsin Community Services. Dr. Young has been recognized with awards for her community engagement by the Wisconsin Public Health Association, the Medical Society of Milwaukee County, Milwaukee Academy of Medicine, and the Student National Medical Association. I am so pleased to welcome Dr. Young to her new role, to the Office of Community Engagement, and to this webinar. Dr. Young, the floor is yours.
Thanks so much, Sarah, for the wonderful introduction, and thank you in advance to the outstanding team within the Office of Community Engagement for helping pull this webinar together, and we're most excited to have all of you join us. I really wanted to start with talking a little bit about me. I think it's, for those of you that I haven't had the chance to meet yet, the work that we're doing in the Office of Community Engagement is so important. And I wanted to be able to emphasize, in my own work and history, the importance of engaging with others in a meaningful way. And to that end, I think of the who of what we are, not just the what meaning titles or other things that are, products related to our work, but what is it that drives us? What is it that moves us and motivates us? And for me, it's ensuring that people have everything that they need to be healthy and to thrive. That's what's important to me in the work that I do. And I know that that's the case for my colleagues that will be joining us shortly. So a little about myself. I'm a Milwaukee native, so I know the Milwaukee community quite well, having grown up here. I have professional and family ties throughout the community that I've enjoyed over the years. I enjoy being a mentor and an advisor for students and faculty and walking with others on their own professional journey. And social scientist, very proud of bringing that perspective to health disparities research and education. So some of the photos here are me and some of my community partners over the years. It's just really enjoyable to grow those relationships over time. Next slide, please. So a little bit about some of the research focus areas. Some of these Sarah hinted at during the introduction, but I'm very much interested in the structural determinants of health, those upstream factors that really can have an effect on people's health over time. I value the perspective of our colleagues that focus on, the individual and the biological contributions to health status. And I think that there's a range of things that we can study when it comes to understanding the health of communities. And one of those is thinking about what are the larger structural conditions that can affect health. And that could be everything from housing access to segregation, food insecurity, any number of these areas that can really impact health over time. So my research over the years has focused in any number of these areas. And it's also included understanding healthcare delivery systems and the culture of medicine. And women's health, very passionate about understanding the factors that can affect women's health over time, and racial health disparities. So those are some of the areas that I've incorporated into my work, but particularly around community engagement, which is definitely a high priority for my own work and the work of our office. Next slide, please. So the mission of our Office of Community Engagement, for those that might still be becoming more familiar with the work that we do, but we're dedicated to improving the health of communities in Wisconsin beyond by advancing the art and science of community engagement and making MCW a national leader in improving the health of the public. And here I would emphasize the art and science, because it truly is an art and a science to doing this work and doing it meaningfully and genuinely and in a way that people are actively engaged and respectful of the work. So you'll hear more about that during our conversations today. Next slide, please. Community engagement is actually a collaboration between institutions of higher education and their larger communities. I think it's what's really important here to know with community engagement and MCW is that this was actually stood up as a fourth mission for the institution in 2008, and been at MCW long enough to see a really nice trajectory and growth and commitment to community engagement over time. And the institution was recently a recipient of a 2021 Campus Compact Award for institutional transformation. So I think we're finding that there's a nice steady growth and interest and passion in conducting efforts that are tied to community engagement and community partnerships. So this work happens not just locally, but it also happens statewide and nationally and internationally. And there's other notable recognitions for this effort at MCW, including our receipt of a Carnegie Foundation Award for the advancement of teaching classification for community engagement. And that was in 2015. And most recently, there's been nearly 1,700 MCW faculty and staff that have reported participation in over 5,000 community engagement activities with over 650 community partners. And that's data that we've pulled from our annual community engagement survey. So thanks to those of you that have taken the time to fill that out. That's information that's really important for us to understand how deeply dedicated we are to this work. Next slide, please. So a little bit of, it's important for us to kind of set the stage for why we're doing this work and having these types of conversations. So the rationale for community engagement, I was hinting at a little bit about this before, the importance of addressing health disparities and underlying determinants of health, but also this interest in contextual factors. Again, these upstream factors that can affect health. The ways in which that we address social conditions, economic conditions, environmental conditions don't just happen in the four walls of the academy. It happens in partnership with community members and organizations. So it happens at the most grassroots level possible. So for those of us that are deeply engaged in this work, this is the foundation. This is the rationale for why we do this. And there's also a demand for it at the community level. So it's not just community members being participants in research studies or recipients of knowledge that is provided or given to them, but they're hand-in-hand partners with us in moving this work forward. So that's really the essence of what community engagement is and is intended to be. And to that end, it allows us to incorporate knowledge from all parties. So there's no one entity that is the sole keeper of knowledge or information. It's the perception that there's only certain individuals that have knowledge about any particular area that can build a form of distrust of institutions. And genuine community engagement is meant to break that down so that we don't have those barriers in place, but respecting all that everyone brings to the process. And it enhances the relevance of the information that we find in any of the work that we're moving forward, that all partners are invested in the outcomes and contribute and are learning and sharing that information. Next slide, please. So there's principles of community engagement. There's a lot of time I could spend just on this, but I just wanted to highlight a couple of areas that I think are particularly important as far as the principles of community engagement. And one is that there's equitable power and responsibility. So any of the work that we're doing in this area, the responsibility of moving the work forward, the accountability, it's not just lying with any particular individual or individuals, but everybody is invested in the work, and that there's strength in the partnership. And those of us that have done this for many years know that it can take many years to do this and do it well. It doesn't necessarily happen just in a few months or a couple of years. There are some partnerships that are 5, 10, 15 plus years, and there's something that need to be sustained over time. So genuine community engagement is staying true to the time that it takes to do this work and to do it well. And there's capacity building that occurs too. None of us are ever the same after we've been deeply involved in this work. We're all growing and we're all learning. So we build our capacity to do this work even better over time. Next slide, please. So what is the impact of this work? When we think about the rationale and the definitions for what it is that we're doing and the why and the pieces of it, the principles of it, what is the impact? What is it that we hope to achieve when we do this and do it well? Well, there's a number of areas that are worthy of consideration. One is increased health equity. As I mentioned earlier, the importance that everyone has what they need to thrive and to be healthy. When we're genuinely engaged with community partners and with academic and other partners, we hope to achieve that there's more opportunities for people to have what they need in order to be healthy. We also hope to decrease health disparities, that we don't see some of these longstanding gaps, if you will, or differences in health outcomes if we're doing our work and finding ways to innovatively work with each other to find solutions. We hope that we're able to close the gap in health disparities. And same with improved social determinants of health. As I mentioned, these larger structural conditions, we hope that those can improve. And also dismantling racism is a very important component. Partnering with community organizations, genuinely listening to each other, understanding structural conditions, all of those things can play a role, we hope, over time in dismantling racism. Next slide, please. So navigating the last year. I'm sure this has been something all of us talk about daily, if not even more than that. The reason why we wanted to have this webinar is really to talk through our own experiences of how we've navigated our own community partnerships, our relationships, our work over this last year, which has of course been a challenge all around. So we wanted to take the time to situate the conversation today in what we've had to do for the benefit of our partnerships, for community members over time, over the last year. Next slide, please. And there's two areas that I'll briefly cover for the Office of Community Engagement. We've had to pivot, as many have, into a response effort, immediate response effort in response to COVID-19. And I'm very proud to say that the work of my colleagues has just been outstanding over the last year. The community connections that have occurred, including communicating information about COVID-19 precautions and strategies with our community partners, reaching out regularly to ensure that people have the information that they need. There's been a number of different efforts tied to collaborative resource distribution, including Mask Up Milwaukee and the mobilization of students and faculty and staff and community members to ensure that hundreds of thousands of masks have been distributed and personal protective equipment were distributed in the Milwaukee and surrounding areas over the last year. Food distribution and food donations that have occurred, and our own response to the AHW urgent response request, for proposals and working with our community partners for those that were looking to get additional funding through that mechanism. And you'll actually hear from one of the artists involved in an AHW funded effort during the quick clip section of today's webinar. And we've also incorporated medical students into our efforts. And we also had the COVID to Action webinar series, which was a series of 5 webinars hosted by our office, which are available on YouTube and focused on community response to opioids, food insecurity, mental health needs, and rural health needs. Next slide, please. And we've also engaged actively in anti-racism efforts. The last year has also put a spotlight on the importance of addressing racism in our society. And we've done that within our own institution. And I won't read through all of these, but our office has been represented on the MCW Community Citizenship Mission Engagement Group, which is compiling and promoting a good neighbor list to support diverse vendors. And you can reach out to Sarah O'Connor for that information. And we regularly discuss our own learnings from the Anti-Racism Daily subscription. And there's multiple ways that we've been seeking out information in this area and ways that we can learn from each other. Next slide, please. So what I'd like to transition to next is introducing our panelists as the next kickoff for our event. I'm just so pleased to do this. These are valued colleagues of mine over the years, and I think it's really going to be a nice conversation. So thank you for joining us for this. So this esteemed panel includes Dr. Zeno Franco, Dr. Bryan Johnston, Dr. David Nelson, and Dr. Leslie Ruffalo. And the panelists today will share their perspectives on the past year and the importance of community engagement during a pandemic. And at the end of our panel discussion, we'll have time for some question and answer. So please drop any questions that you have into the chat throughout our discussion at any time, or you can also send them privately to Sarah O'Connor, and she'll be compiling those for our discussion later. So what I would like to do next is to ask each of our panelists to take 1 to 2 minutes to introduce yourselves and let the audience know a little bit more about the projects you've been working on over the past year. May I call first on Dr. Franco, please?
Thank you, Stacy. And you're right that it has been a very intense year, I think, for all of us, and we've all been learning together different strategies in the response. I think for me, one of the biggest pieces of this pandemic and sort of thinking about how to respond to the pandemic is sort of a glimmer of a more optimally functioning community. And I'm very focused in sort of the Milwaukee area. Others on our faculty and staff are focused throughout the state. But this year, as part of the AHW Rapid Response Grant that Dr. Young mentioned, we came into partnership with the County Office for African American Affairs and the city Department of Public Health, as well as the medical college, and sort of thinking through how to partner between kind of the university complex and the city and county government, and really respond on the ground in an equitable way, in a culturally tailored and adapted way for the different communities that we're serving, has been, I think, a huge key to this process. And I think really speaks to the strengths that the university complex, in this case, the medical college, has in terms of that cultural tailoring piece. And a place where we are uniquely positioned to assist the governments in the region to sort of think through how to really equitably respond. I'll just take a moment more, which is to say that the AHW grant that I received along with Dr. Katinka Huyer, the city and the county, was really focused on activating local leadership so that we were co-constructing the response to COVID-19 with the communities. It was not a top-down approach for that project. And I think it has really served as in a sense, an emblem and a learning tool for other groups that maybe are interested in community engagement, but haven't really seen it done before in this way. And, that was, I think, really taking three key ideas, which is using off-the-shelf advertising, public health messaging, and tailoring it slightly for the communities that we're trying to reach, really for communities of color in the region. And using standard sort of advertising strategies very early on, but just tailoring them enough that they would have better resonance in those communities that we're trying to get to. And then actually stepping back when we had a little bit more time and engaging with community thought leaders and artists to say, what would you message on this in terms of infection prevention, infection control, using personal protective equipment, and why it's so important? How do we talk to our communities about differential infection rates and differential death that was happening early on in the COVID-19 experience? And really kind of relying on their expertise, not just our expertise, to create a public health messaging campaign. And the last phase of that project has really worked with community health workers from 4 different communities of color: African American community, Hispanic, Southeast Asian, and Native American. And that has been a really dynamic process where the community health leaders, I want to call them, not community health workers, right? These folks are leading the charge in terms of our response across the board, delivering food, delivering masks right to people's houses if necessary. And that has been, again, a really dynamic shift in how we've approached the response. And I think it tells a different story about how communities can actually not just be the recipients of assistance, but think through, how do we do this as a society?
Excellent. Thanks, Zeno. I heard so many wonderful things in what you said, and the pivot to addressing the pandemic is part of it for sure, but talking about the mobilization and the leadership amongst our community members, I think is just particularly powerful, and it's so much of a hallmark of what community engagement is. Thank you for that. Dr. Johnston, please.
Sure. Hello, everyone. And thanks for the chance to be here. I'm Bryan Johnston. I'm a family physician at the Medical College of Wisconsin. I'm a faculty member at the All Saints Family Medicine Residency program on the north side of town. And my work really centers around health equity in all of its different forms and facets. So from the clinical side, the education side, and the community engagement side. And yeah, it's been quite a year. COVID, in many ways, helped me to align some of those efforts in my work because it kind of got everyone interested in the same thing from all those different sides. And we'll talk a little bit later about some of the things that we've seen on the clinic side to respond to COVID. But I wanted to just highlight one project that is kind of a smaller scale project than what Dr. Franco was talking about, but I think has some cool takeaways. And that's called the Food Doctors, which is a nutrition education program that we've been working on for many years. Medical students go to elementary schools and do nutrition education with 3rd and 4th graders. and do some kind of mentoring and interactive teaching around health and wellness. So in this time, not just on the healthcare side, but all throughout the community, we were dramatically affected. Of course, schools were not spared from that. So a lot of schools had to close and just had dramatic shifts. So we saw our partners really struggling with that, and a lot of the kids really struggling with that. So suddenly kids are at home, their families are having to make transitions and changes. A lot of kids didn't have access to food that they would depend on their in-person schooling for. And a lot of things, kind of peripheral things like nutrition, especially nutrition education, which was already kind of a peripheral thing, were really at danger of being lost. So we really were pretty proactive on our team with trying to support our partners and support our students in that time. So we were able to continue to be part of the curriculum by pivoting to a virtual model, which had its own challenges. And actually, as part of that, we found that we were able to engage not just with the students, but also with their families, because suddenly we are working with our students in their homes and in their kitchens. And it was a pretty interesting transition. So we found some interesting leverage points and benefits from that. We also found ourselves in this kind of interesting position of being able to be a resource connector. So many families found themselves suddenly in a position of being food insecure because of lost income or other, the schools being closed or other reasons. So we were able to kind of be an interface in that way too. So I think that's just an example of one way that we were able to be really nimble in continuing to support our partners, but also finding some kind of ways to find some silver linings.
Excellent. Thanks, Bryan. And thanks for presenting the perspective of working with students and the importance of food insecurity during this time, something that individuals and families have been grappling with for quite a while, and certainly has been that much more exacerbated during the pandemic. Thank you. We'll be hearing more about that coming up. Dr. Nelson, please.
Thank you, Dr. Young. I was thinking about how I might start today. And I'm going to start with a singular word, a word that sits above my desk on a card, and that word is grace. This year, I've needed a lot of grace, and so I've had to give a little bit, but I need a lot of it. And I think the other thing that I want to say is that appreciation, that's another word that stands out for me. I look at the four of you and I am so appreciative of the work you do. And for all of our staff and people who often do things quietly. Oh, it is so amazing the work that you do. This year has been a year of what I will call fear and uncertainty. Nobody knows what's around the corner, whether it be around the pandemic, the novelty of it, the loss we've experienced, the things that are communicated and miscommunicated. Something we take for granted is this idea of communication. And we've tried to pivot this year in terms of communication. We've started a podcast called the Days of Learning podcast. And a shout out to my friend and colleague, Kelsey Heindel, who helps direct us in that space. We've tried to look towards things that are going well, hope, if you will, in oftentimes areas where there is hopelessness. And as I go forward in this work, whether it be through the podcast or the issues that I am working on and a part of, this pandemic has heightened a sense of urgency for me and for others about the inequities that exist between the social determinants. Why is housing a luxury and not a right? Why is food a luxury and not a right? Why are our babies still being poisoned through lead to no fault of their own? And as we look forward to this, coming out of this year, I am doubling down on my commitment not only to the present, but how we look to the future, like so many of us do, as this issue has been around for a long time. But one of my partners said, the breeze of change is blowing, and it's up to us to turn it into a wind. Thank you, Dr. Young.
Thank you, David. Such powerful words, and you're always so, I think, insightful and thoughtful. And everything that you said, I think, was just spot on. The things that we're grappling with as a community and what we see our community partners, friends, loved ones deal with as well. And grace, I think, is such an important word to have. And we'll be engaging the audience in a moment too to share some of their own words that resonate at this time. Before we do that, Dr. Ruffalo, please, would you like to introduce yourself and what you've something you'd like to highlight over the last year?
Sure. Thank you. Thank you, Dr. Young. And hello, everyone. Good to see you this afternoon. And it's wonderful to be with all of you. If you didn't catch our introduction slide, just to really quickly introduce myself, a faculty in the Department of Family and Community Medicine. Within my role, I share my responsibilities between being a researcher, but also having a strong footprint in medical student education. So feeling the pull from both sides often. And one thing I would like to highlight is I'm going to go to a place of vulnerability right now. And so at the beginning of the pandemic, I remember hearing the great work that Bryan and David and Zeno were doing and having this moment of, oh, I'm not doing enough. I'm not out there on the front lines. Oh boy, like what can I do? I should be doing more. And it gave me a moment of pause. And then I would take a step back and I would say, but wait, my mantra right now is maintain, maintain, maintain. At the start of the pandemic, my family, we have 2 young children at home and our daycare was closed down. And my husband and I were passing the baton back and forth all day long from 6 a.m. in the morning till about 5 p.m. at night, take a family break, back at it after the kids were down. And I was also in the wonderful situation of having 4 community engaged research projects funded at the time at the start of the pandemic, received within 1 month notice 2 more that got funded. And I had this moment of, I don't want to let my community partners down. We're on the development stages of these projects. We're not ready for implementation. We're not ready to go live, but we are developing the work right now. And how do we not lose momentum? How do we not lose where we're at, that strong foothold that we have in progressing some of our work? And the same would be true for my role in medical student education. The pandemic introduced this all virtual environment for us. And so thinking about, well, how do we transition all of our courses in my department to virtual? How does the family medicine clerkship, our primary clinical rotation, accommodate learning for our students? And so so that definitely just became my mantra, is how do we maintain, how can I help do my part, follow through on my commitments during a time of uncertainty and struggle within my own kind of home life. And somehow 14 months later, the new norm has been established and we're doing okay. So I'll leave it at that.
Thank you, Leslie, for that and for the vulnerability. And I'm sure I think I can safely speak for many of us that the balancing and the juggling of, the personal life and the professional and trying to maintain is something that we've all been going through. So I'm sure you're not alone in that, but certainly I think it's important even that we're sharing those things and what we've been encountering, because I think it reflects our shared humanity in that way. So thank you for doing that. And it's just so important for our conversation today. What I'd like to do next actually is engage our audience. And if I could ask for the next slide, what we'd like to do is introduce, this might be a familiar thing for many of you, is to introduce a word cloud exercise. So I would like to ask the audience if you could respond to this question. In 1 to 2 words, what is something unexpected that changed in your community engagement work over the past year? And there's multiple ways that you can answer this. One that might work quite well for many of you is to use your smartphone and to scan the QR code there in the middle of the screen. If that's not possible for you, you can also join us by text and text your 1 to 2 word response, or you can also join by web if you go to pollev.com, and the instructions are there on the screen. And as those results come in, Erica Pedersen with our team will show us the word cloud. So we'll be able to see across our wonderful group here some of the things that we've also been needing to address in the last year. So while that is happening, I would like to continue to engage our panelists here and move on to kind of a question that's really tied to just some additional reflection and something, again, that I think we can all appreciate in this room, and that is the need to adjust to the virtual environment and to social distancing. So I'd like to ask our panelists, what have been some of the things that have what are the innovations that you've implemented in order to accommodate virtual and social distancing in your own work?
I'll jump in. And I'll be quick with this one. I don't know that it's that innovative, but certainly something that I felt helped me and my community partners move our work forward was more regular meetings, touch points, connections, but maybe not meeting quite as long. One of my partnerships that comes to mind pre-pandemic, we were meeting twice a month and had extended meetings, 2-hour meetings to crank through our workload, and that was working fine for us. But with the pandemic and and we were also meeting in person, traveling distances, commuting, things like that created some inefficiencies in our workday. When the pandemic hit, we switched to meeting weekly and just for shorter amounts of time, 30 minutes, hour check-in every week, and noticed that we lost no ground. It was, and in some ways, I feel like our partnership is stronger for it today, that the consistency which we're connecting now has actually strengthened our partnership.
Great, thank you, Leslie. And those of you that are able to join and look at the screen, you'll see some of the results coming in, some really powerful things that people are posting that's been unexpected, that has changed their own community engaged work. So as those keep coming in, you'll be able to see those on the screen. Any others of our panelists additional thoughts around innovations that you implemented to accommodate our new virtual realities and social distancing in the last year?
I can jump in, Stacy, and I think one of the things for all of us, for us as faculty and staff, as well as for our community partners, just to recognize that there were significant losses this year. And so, I think one of the things that came up is the number of funeral services that, maybe we couldn't have in sort of a normal format. And for our family, just to speak kind of at a personal level, as Leslie was, we had about 6 people close to us who passed from COVID-19 or complications thereof. And some of them were pretty old and, they were close to passing anyway. Not that lessens the blow, because those were isolated deaths. They were often not able to be seen by their families. But, I think we were able to be present with people who had losses across the country, where we would not have been able to be present at those funerals if we had to travel to each one of them. And I think that that's a really powerful thing. It's actually made me think, one of the things that I've encountered the most as a difficulty is people not being able to be there for important transition points in their families' lives. And that's really come up for me with incarcerated folks who can't be at a funeral for a father or a mother. And thinking through, okay, maybe the person is incarcerated and we can think whatever we want about the justice system, but can we make this burden of guilt about not being there at a transition point somehow less burdensome? I think that's an incredible innovation. And also celebrations too, right? We were able to attend a a wedding that was entirely in Polish at a Polish Catholic church in another state. And I was fascinated just to watch the entire thing happen. And so I really want to come to this idea of telepresence. We talk a lot about remote, virtual, whatever. But I think sometimes we're able to be present in ways that we couldn't otherwise be through this medium. And I think we really need to think about how to capitalize on that as an innovation.
I love that, Dr. Franco, and I want to jump on that too. Just from the clinical side, we've been able to have that connection persist even more especially for patients who are more vulnerable, who have more on their plates, who have more barriers to accessing traditional medical care, which involves like having a phone that works and is consistent, and having transportation, and having like organizational and support that can take care of your kids while you go and see the doctor and things like that. So for instance, in my work, I care for patients struggling with substance use disorders, and that requires a lot of follow-up and a really intensive relationship. And what I noticed in COVID, as we started to incorporate virtual visits, which we really hadn't been doing before, was those patients who were really struggling and were more vulnerable and maybe wouldn't show up to an appointment, I was able to reach out to them and continue and follow them throughout the course of their journey in a way that I would not have been able to before. So I had patients who were, for instance, evicted and, you know, bouncing from shelters, and, you know, their cards weren't working. And I was able to continue providing care throughout the city in a way that I never would have been able to before. So there's definitely some truth to that on the clinical side too.
Thanks so much for that, Bryan and Zeno. And I think what you touch on, Zeno, is really important, and it's recognizing the loss that so many of us around the country and around the world have faced, and how do we manage that and walk alongside people that have experienced that, and to some degree, ways in which we've been able to still be connected with each other in perhaps ways that we couldn't have before, even if we need to share in a sad experience or a grieving experience. So I think it's really important that you touched on that. And Bryan, your comment about ensuring that there's still ways that you can see and take care of patients is so important, obviously, in the clinical world, because people always need healthcare, you know, no matter what other things we're going through. So finding ways that we can continue to do that work, not only in community engagement, but the other components of what we do, whether it's our teaching, clinical service, research, what have you. I think being able to maintain that is critical. And I would actually like then to ask the next question to our panelists, which will also then include our audience too, as well, with another word cloud exercise. But based on some of what you shared, or perhaps what you have not been able to share as yet, what are some of the things that you'd like to maintain and carry forward in the next however long? What are some of the things that perhaps you've done new or different, like, that you think is important to keep going and keep doing?
Let me start by saying I have been striving to slow down a little bit, slow down my thought process, and slow down my reaction to issues. What I will not do is slow down my commitment to the urgency that exists within our greater community. And I've had heightened awareness about my own privilege and the optics of my privilege over the last year, as the murder of George Floyd and others has unfolded before our eyes, and at times are seemingly to be powerless. But if we can change the trajectory of our own sense of being, might we align with others to change that trajectory as well? And that may be a bigger question, but frankly, it's one that it needs to be asked by our entire community. And that's, to me, is how we change. And that's how we change from the status quo, or otherwise we are maintaining what we have. And frankly, everybody here knows that that's not good enough.
Thank you, David, for that. And I'll just quick mention, we did pull up the second word cloud opportunity for those that would like to begin to share in 1 or 2 words the things that you would like to continue in the future. But I'd like to return to our panelists. Anyone else would like to chime in on that particular question of what you'd like to maintain?
Yeah, I'll jump in. One of the things that I've noticed about my workflow is that there seems to be more of a fluidity to it. I think pre-pandemic, my workload is very structured, very compartmentalized. This is where I'm going to be at such and such time, and it still is to a certain degree. But I also think that there's been an augmented understanding of there are 24 hours in a day, and how we get the work done a little bit is there's some organic nature to that. And I really hope that sticks with the work. Not to say that, we're not going to have commitments and you're not going to have to be somewhere at Thursday afternoon from 2 to 4, but that's all well and good. But there's a fluidity to the work now that I've embraced. And I think with that comes the need to also put some boundaries around your workday as well. Set some time aside for your family and for other things that you're interested in. But I really again embrace the fluidity of it. The other thing too is I feel that David in his comments just a moment ago mentions this heightened optics of our own privilege. And I think the pandemic has also given me some heightened insight into the reactivity that my community partners bring to their work to serve the needs of their constituents and their stakeholders. And it is just so much tuned that in for me as I've had small talk and side conversations with community partners over the last 14 months, just to see how hard our community agencies, our nonprofit organizations, our resource providers, how you work just so tirelessly to meet the demands of the community. And that has just, again, that has just become so laser focused for me as I've witnessed your efforts to care for the communities that need it most during this time. And so I hope that sticks with me, that I never lose sight of just how much behind the scenes is happening to meet the needs of our communities.
Thank you, Leslie, for that. And I would just say what's coming up on the screen from the audience is just really incredible. I hope everyone is taking a chance to, or taking a moment to see what people are offering, the things that they would like to continue: intentionality, relationships, mindfulness, patience, compassion, empathy, communication. I can't read all of these, but they're I think just so much of what we need to be continuing to do. But I'm really enjoying seeing what folks are thinking about for themselves and perhaps for their own partnerships. So thank you for continuing to offer those. I would like to ask our panelists to reflect a little bit on the missions of our institution and the ways in which community engagement has interacted with those. As I mentioned earlier in my comments, community engagement was added as a formal mission for the institution in 2008, and it stands alongside research, clinical care, and educational excellence. And I would love to hear the perspectives from our panelists and the ways in which you found, especially over the last year, the ways in which community engagement has interacted with those other respective missions. Dr. Johnston, can I call on you first, please?
Absolutely, Dr. Young, thank you. So I'm going to talk just a little bit from the perspective of the clinical mission. And I really think that community engagement has never been more important to the clinical aspects of what we do at MCW. I was just this week, I had a really interesting conversation with an anesthesiologist about engaging learners in the community, because even anesthesiologists need to know what their patients' lives are like and the environment that they're coming from, and then the one that they're returning to after their hospitalization. And to me, that was just a really powerful perspective, because it's not the first group that you would think of as having a commitment to being in the community. But that perspective and mindset about what the community context is like for patients will help those learners to understand their patients better and provide better care. It can't not do that. Yeah, so I just love conversations like that. I think there's more of that recognition going throughout MCW. And I think the start of a lot of perhaps a different perspective on how we do clinical care. And I just really look forward to seeing some of those conversations and interests just grow and flourish. I do want to talk a little bit about some things that we're doing at the All Saints Family Medicine Residency Program and the Family Health Center on the north side of town. So we consider ourselves a community-centered clinic. So we're patient-centered medical home, but we're also a community-centered clinic. We've spent a couple decades really with that perspective, investing in the community. And it starts from the way the layout is at that, for those of you that haven't been there, painting the pictures. There's a big green space in the middle of that. There's the clinic. The clinic is surrounded by an exercise track with exercise stations. We have a teaching kitchen inside. We have an exercise area inside, before the pandemic. Now we do outdoor exercise classes. And we also have an urban farm. So we have a 1+ acre urban farm that grows fresh vegetables that are used by the community. So that's just kind of what you're walking into. So the resident physicians and the medical students who are working with us all participate in all those aspects. And over time, they develop their own community related interventions and community projects and contribute in there and put their stamp on and impacting the community in those ways. And we have staff who are specifically dedicated to community work, as well as faculty who support those ongoing partnerships. So during the pandemic, I think a lot of those existing relationships were really well suited to respond to the community in a rapid form. So we were looked to as a resource for the community. One of the big issues early on was testing. So we became a testing center. Now on the clinical side, another big need is vaccination access. And so we're now a vaccination site, not just for our patients, but in a partnership with the health department for anyone in the community. You don't need an appointment. We don't need insurance. So those kind of things are just like rapid kind of response stuff that came from just needs that we're hearing and seeing in the community. And of course, the other dynamic shifts in the type of care we're providing, inpatient, outpatient, and all kinds of procedures about keeping our patients safe and taking care of them when they get sick. But we also had the chance to really double down on those social determinant of health related interventions that we've just kind of been focusing on for a long time. And things like the shifts in food security, we were able to implement early in the pandemic a food security screening process in our clinic, and actually reaching out to patients and screening for food security, and then connecting them to food that we had available at the clinic, and then also resources around the community, and other related social determinants of health interventions, whether that's through legal support for combating pending evictions or other aspects. So we really tried to be a community resource and a hub and connector during that time, because we know that those social determinants of health are so dramatically reflected in our patients' health. We see it all the time. That's like the water we swim in. So we continue to be on that journey, and I think that is a model to think about how to really be community engaged in the clinical work that we do.
Excellent. Thank you, Bryan. Dr. Ruffalo, I'd like to call upon you to talk about the medical education perspective. And actually, if it's okay, I would like to incorporate a question from the audience for your response. And it's from Kathy Gale. And the question following her statement is, our community agency has benefited from medical students and other disciplines, social work and nursing, connecting with our older adults via telephone for regular wellness calls as in-person clinical settings were unavailable. The experiences have been positive for students, helping them to gain awareness of communication. Do you envision these types of experiences continuing for students and/or researchers to increase understanding of social determinants of health?
Yeah, thank you. Thank you for that beautiful question. And for those of you on the call, Kathy and I did not rehearse or stage this question. Kathy is a longstanding community partner of mine and good friend as well. And so Kathy, perfect question, because it was, as I was preparing some responses for today's, I will roll a response into that. So first and foremost, with the intersection of medical student education and community engagement throughout the pandemic, I think we can acknowledge that we really saw our medical students rise to the occasion. I'm going to speak mostly, my comments are mostly going to be geared towards our 3rd and 4th year medical students who are largely in their clinical rotations during those years. And, you know, in March of 2020 witnessed a complete shutdown of their clinical work. They're pulled off their clinical rotations, pulled off the wards, shifting to virtual. As a non-physician, I can't even begin to imagine what that felt like for them. The fear that they probably experienced about how am I going to continue growing and further my training as a physician? What is this going to look for in my residency process? I can only imagine. But what we saw is many medical students take that and channel that as an opportunity to connect for a COVID response program, initiative, whatever it might be. And so I really enjoyed in the early stages of the pandemic watching the InfoScope banner come through. And for our community partners on the call, InfoScope is our news pings of what's kind of happening institutionally. And so we were learning of the ways that our medical students were supporting our communities and channeling again that extra space in their schedule now to do good. Coupled with that, I think that the pandemic transformed many medical schools, many medical students in ways that we didn't anticipate, in that they had this increased awareness of the ways that the COVID-19 virus disproportionately impacted specific populations. And they started to connect the dots a little bit more deeply about, wow, how does my patient's psychological context, how does my patient's social context impact their health and their health-seeking behaviors? And our medical school curriculum, it's woven in there kind of episodically, but we can do more to address health inequities. We can do more to address social determinants of health. And this was an opportunity, I think, that our students were drawing those connections. They were seeing that in such a magnified way. And I think this really aligns well with Carol Voss's earlier comments about, you know, Wi-Fi limitations, and does your laptop even have a camera that you can use, and food insecurity and housing. And again, I just think our medical students were connecting those dots in ways that they hadn't before because the pandemic spotlighted them so deeply. So to answer Kathy's question of how the Medical College of Wisconsin can move forward on this and how we can carry that forth, we're currently, for the medical school at least, we're currently undergoing a curriculum redesign. And one of the main features of that curriculum redesign is thinking about how we build a stronger backbone for health equity curriculum that exposes all of our students to a fundamental baseline level of understanding of health equity and social determinants of health that is woven through day one. They step on campus as first-year medical students, and that thread carries all the way through their 4th year. And baked into that is that didactics and talking about it is not enough, that we do need to make sure that our curriculum is robust enough to give students a chance to do some experiential learning in this space. And maybe some of that experiential learning, again, is going to be in clinic as they see their patients, but how do we create spaces for them to reflect on those experiences with their patients to draw some more meaningful learning outcomes. So I would encourage everybody to stay tuned. Hopefully some really positive shifts in medical student education coming up, and just the way we train our future physicians to be more community responsive.
Thanks so much, Leslie, for that perspective. I want to bring in Dr. Nelson on the research perspective, and then also Dr. Franco about how we synthesize our work with that across our other departments. And I might also, weave in a little bit question from the audience, because I think people are raising some really good points in the chat, and I want to make sure that we're able to touch on that. So, Dr. Nelson, can I call upon you to talk about the research perspective?
Thanks, Dr. Young. I really want to highlight and double down what my colleagues, Drs. Johnston and Ruffalo, said about the intentionality of the connections that are happening between our office, community engagement, and the other missions. I want to highlight really four areas that have really strong potential to highlight the idea of both research and community engagement. It's that intentional connection. Working within family medicine, there's a group of family physicians and researchers that are working on how can we develop an early warning system around eviction. So those people who might be more likely to be evicted and coming to get their health care, can there be a role for medicine in understanding the phenomenon and how it might impact health outcomes? Within radiation oncology, which is really high tech and relies on much machining and physics and things that have to do in the clinic. But there are radiation oncologists that are asking how the radiation oncology department can be anti-racist and how the radiation oncologists can be more community engaged. Those things which would directly relate to the health outcomes. Some surgeons are studying the role of social determinants on pancreatic cancer, where we know that it is a terrible disease with not great outcomes, but yet we're learning that the importance of isolation, or the idea of eliminating isolation, providing social support, are vital to people's not only surviving, but they're thriving. And finally, I recently met with a cardiologist. Heart disease is still the #1 killer in the United States and in Wisconsin. And yet, the areas that have the strongest parts of prevention for women, exercise, food, connecting to clinical care in primary and specialized care like OB/GYN, for some of our communities with the greatest inequities and greatest disparities, those prevention areas are hardest to reach. We should not be just asking what we can do, but why this exists. And so this is where research, where we can describe the issue, where we can develop interventions, can change the trajectory for our most vulnerable and our most disparate citizens. Thank you, Dr. Young.
Thank you, David. Dr. Franco, your perspective on the role of community engagement in relationships with other MCW departments. And what I'll add quickly to that is what I see in the chat, a question from one of our MCW colleagues trying to understand, how do you know who's doing what? How do we make some of those connections with community partners? Or how do we know that somebody in another department is already engaged with a community organization? So perhaps in your comments, you could speak to how we can best help our colleagues make some of those community connections.
Absolutely. Thanks, Dr. Young, and also thanks to all the faculty for their comments. I think this has been really reflective, and just for full transparency, it's been a tough year. And some of the stuff that was said, even today, as mild as it is really touching some personal tough points for the response. For me personally. So I just, I think for all of us to just recognize that, it has been an emotional roller coaster. We've been through a lot, and I think there's a lot of opportunity and a lot of things to be gained, and to also create spaces like this to really reflect, to be together, to think through how we want to move forward is really, really important. So I appreciate your emphasis on that, Dr. Young. I think, one of the things that I have really learned in this process working with community partners is keep it simple, right? And when you get to advanced practice and community engagement, and I do feel like I'm starting to get there after 10 or 11 years doing this work, where I really understand sort of where the boundary lines lie, where things are going to go in a bad direction, how to kind of think through really creating trust. There are some powerful examples of how community engagement can be done that really address all these different missions within the college, and also across the board externally as well. And so I just want to touch on one really simple concept, which is stacking. So what I have come to do now is to kind of, to Dr. Ruffalo's point, is to have a standing meeting rather than like we could have like 5 meetings at different times. We're meeting with this group every week at this time, right? And really working through process so that it's an open meeting, that there's discussion, that frankly, there's very little agenda right? It's people checking in. What are we doing operationally in the response to COVID-19? And then what we've done with that is we've actually overlaid other partners coming in to talk about what they're doing so that people can really get a sense of where some connection points are. And we've overlaid that with students being able to come in and really getting a sense of what advanced practice looks like in community engagement. So we actually have medical students walking into a full-on public health response to COVID-19 where they're seeing experts from the public health department talking to community health workers, talking to Moderna and Pfizer. And I think the medical students, frankly, were surprised because oftentimes and I say this with all due respect to ourselves as a major teaching institution, sometimes the students are really hoping for a dynamic teaching experience, and we give them kind of stair-step stuff. And they were just sort of thrown in COVID-19 to, we're doing it. We're actually doing the response and you can watch. And I think that's been one of the beauties of this virtual environment is we can have the students join in that space. I think to this point that, Dr. Young is mentioning, and I think it was coming up in some of the questions, is early on, the Kern Institute realized that we had an urgent need to get masks out into the community. With the Mask Up MKE project, there was a recognition that we actually had the same material that was used to make surgical masks at a manufacturer just to the north of Milwaukee. They made those materials available. But Kern Institute, in its wisdom, said, we're not sure who to give these masks to first, and we want to do that in an equitable way. And so rather than just doing, they reached out to Community Engagement Office and said, can you help us think through how to equitably get these masks to the right places? And so we were actually able to consult with them to say, here's a list of all the agencies. Some of the agencies have their doors are closed. And I was calling, I'm going to call out one of my community partners who was on the call earlier. I'm not sure if he's still on. I called up Manan Sabir, who I had worked with from Walnut Way years ago, and said, I'm desperate. We need to get masks out. Can you help me? And he said, I'm there for you. Drop them at my house, right? Everything was closed, right? Kern didn't have Manan's cell phone number, but I did, right? And that's how we rolled through the initial real problematic months, is actually dropping back to relationships, oftentimes almost personal relationships that we have built in the community to get around the fact that doors were closed, apparently at some of these agencies, and to find pathways. And so I think that's one of the other things that I really want to emphasize in this, is that COVID-19 has moved us to a point where there are often workarounds that can get to addressing community needs today, not tomorrow, not next week, but today. And we have done that in many different ways. Sometimes it comes down to moving money in different ways than we've done in the past. We've had to be extremely flexible. And the city and the county have also had to be extremely flexible. And those are, I hate to say it, it has taken me 10 years of working with the community, right, to say, let's improvise, right? Some of my veteran partners, right, the motto in the military is improvise, adapt, and overcome. And they have drilled that into my mind. And guess what? MCW needed to do that during this year to really address fundamental issues on the ground in the community.
Thanks, Zeno. I think, I was nodding throughout everything you were saying because it was all resonating, but definitely those last few words you had left us with, adapting and overcoming. I just think it's so important. And when I think of our work moving forward, what does this look like? We've learned a lot of lessons in part because we just sort of got pushed into having to do it and having to figure it out, and figuring it out, as you said, not next week, not next month, but that day. And I would hope those are things that we can take into our work moving forward, and not slipping back to, what was perhaps a, comfortable spot before all of this happened. So if there are some, bright spots and silver linings, it's that we learned what we can do when we really need to do it, especially when it comes to community engagement. So thanks for those thoughts. And I didn't want to miss one of the questions and comments in the chat from Yvonne Greer talking about, how do we ensure that moving forward, we don't slip back into language that suggests, we're working working with individuals or communities that are considered the other, quote unquote, and ensuring that we're still the we moving forward. And I do think a lot of that is intentionality. And I saw that it come up in the word cloud earlier when people were reflecting on what is it that they want to maintain. So us being intentional in our conversations about how we are engaged with each other and calling things out when we need to and giving each other grace, but ensuring that now that we know what we're able to do even more so than we could in the past, that we're able to stick to that and hold each other to account when we need to, but knowing that for a lot of our community engaged efforts, it's grounded in good principles and the importance of walking alongside each other. So thank you for those outstanding comments and questions in the chat. I apologize if there was any that I was not able to get to in the interest of time. But what I would like for us to transition to, because this is just such an outstanding panel and thank you for your comments. I'd like to transition to Erica Pedersen, one of our outstanding staff members in Office of Community Engagement, who is going to share with us some video examples of this work.
Hello, thank you very much for joining us today. And I'd like to introduce our next segment, which we're calling the CE Quick Clips. So for the next portion of this webinar, we'll be sharing some videos, a short 5-minute about videos that people are highlighting their projects where they've innovated along the lines of communicating and connecting throughout the past year. So some of them are very practical about meetings, and some of them are about strategies and some very conceptual ideas about art. So I encourage everybody as we go through this next segment and view the videos to share your thoughts and questions in the chat. And at the end of the session, we will all join together and do a large group discussion and kind of go over and tie some of those themes in innovation in communicating and connecting together at the end.
Hi everyone, my name is Marie Balfour and I'm an M2 at MCW, and my research last summer was entitled Empowering Primary Care Family Networks Toward Nutrition Behavior Change, done in conjunction with Dr. Bryan Johnston with funding from the Wisconsin Medical Society Foundation. My project started as an offshoot of the Food Doctors at MCW project, and this was started by Dr. Bryan Johnston and Dr. David Nelson a few years ago, and consists of 3 nutrition lessons for 3rd graders at a couple local elementary schools. And the lessons would be a 15-minute interactive presentation with students, and then at the end of the presentation part, we would do some snacks with the kids that related directly to the lesson topics, some of which include things like eating the rainbow, whole grains, reading nutrition labels, and making sure that all of your meals have the right balance of fruits and vegetables, things like that. When I joined the project in the fall of 2019, they had done some efficacy studies on the lessons, and then we're starting to branch into involving the parents with the lessons and then also the teachers as well. So my project got started based off of some of the parental involvement, and I was really looking at how do family interactions and influences define nutritional behavior within those family units. And so with this project, I was originally set to do kind of an Iron Chef style family cooking lessons and have the families cook in person, but with COVID, that was not possible. So we switched over to an interactive virtual lessons and then doing the phone calls with families to hear some more about some of their nutritional challenges as a family and also some of their triumphs, things like that. So as we were doing this all virtually, we had some recruitment hiccups in the beginning. I think we were very lucky to have the buy-in from the schools, and they were able to reach out to parents through a lot of their avenues. But I would say for anyone doing a fully virtual recruitment, I would definitely recommend identifying ahead of time some of those avenues that you can recruit your participants from, and being ready to kind of pivot and deploy, those new avenues whenever you find that maybe something's not working. Because I think for my project, we lost a little bit of time in the beginning. I would say, kind of figuring out what our next move would be if a certain thing wouldn't work. And that obviously impacted the timeline of the project as well. I think if I was going to do it over again too, I would have started maybe with a needs assessment, I would say. I think as we were starting to recruit, quarantine had gotten extended, families were starting to be working full time from home, and kids were starting to get out of school, the students. So, I think a lot of people were trying to figure out what was going to work best for them. So maybe doing a needs assessment in the beginning to kind of figure out where people's head was at would have been helpful as far as, planning the lesson timing and things like that. And then also giving people the same experience, or as close to we could, as what the in-person lessons would be. So, being able to maybe pause and ask more questions than we would in person to keep people engaged, and use the Zoom chat as much as possible to keep people really involved with the lessons there. The main triumphs and takeaways I think I have from the project was just we were able to continue our partnerships with the school and with the community. Being able to do the virtual lessons over the summer was really helpful because we had kind of a finished product to give to the schools when we were going back for the school year time lessons in September. We were ready to go with that. And I think that helped to strengthen our relationship with the school because we were able to continue throughout the year. And then also connecting with families in their, in their homes on the phone. I think we had always with the project been interested to see how can we get parents involved with their kids? And this was something that we were able to do virtually. And I think because it happened towards the beginning of quarantine, maybe, people are looking for some more, connection outside their home and things like that. So it was really great to be able to involve the parents, something the project had always been interested in. And then the final piece was just expanding the lessons potentially. We have those efficacy studies already with the project. So now that we've done it virtually, there's a chance to reach even farther, see some schools that maybe are a little bit farther from the Milwaukee area and be able to give the lessons to them too. Thanks again for joining me. And if you have any questions, feel free to send me an email.
Hello, my name is Maya Pazdera, and I am a program coordinator at the Medical College of Wisconsin.
And I'm Langston Verdane, program leader of strategic partnerships at Children's Health Alliance of Wisconsin.
Today, Langston and I are discussing how we've built new relationships from the ground up in a virtual world. Prior to the pandemic, our community academic team had began writing a grant proposal with multiple new partners. We were very excited when our grant was selected to be funded, but we quickly realized that all aspects of the project needed to be done virtually. In-person meetings are a cornerstone of conducting a community-engaged research project, but COVID-19 imposed a new way of working together through virtual connections. Langston, myself, and our other project members have never actually had the opportunity to sit together in person to work on our project. This switch brought both opportunities and challenges.
Soon after we started our project, one big opportunity became apparent was that we now had the ability to network and learn from experts everywhere. There was no need to wake up early and drive to meetings out in Madison and Eau Claire. No more driving for hours or having Google send me to the wrong meeting location twice or even 3 times. Working virtually allowed us to connect with people all across the state and frankly around the country at a moment's notice. Another benefit to the virtual environment was having a new way to engage with our parents and family members. Historically, meeting with community members has been a challenge in my line of work because of conflicts with work schedules, transportation issues, and childcare barriers. Because of this virtual model, parents and community members have a seat at the virtual table. We started this project in the fall, and by this point, most of our community partners were used to video meetings. Most folks knew the challenges of managing a virtual group, so they gave us a lot of grace. By and large, meetings ran smoothly, and there were also always some technical glitches here and there, but we have a team that's open to trying new technology and finding ways to stay engaged with each other.
Despite the benefits of virtual meetings, there are a few drawbacks. By the time our project began, Zoom fatigue was apparent to us. To keep everyone engaged, we had to look into creative ways to continue to get to know each other better, including virtual icebreakers. Here's an example of the team reflecting shortly after New Year's on what they were looking forward to in 2021. Here's another activity we did where the team called out diverse businesses they supported in our community. Time concerns were also another challenge. It might seem like we should have more time now that many of us are not commuting. Yet with the mix of work and personal obligations, our time is more valuable than ever as we're pulled in more directions. Our audience may not be as captivated at home with their families as they would be in a conference room, but we are accepting this as part of our new virtual environment. We created intentional efforts to adjust to these challenges, such as reducing our team meetings to be 45 minutes rather than an hour to allow for more transition time for those who have back-to-back virtual meetings.
In closing, it's probably the understatement of the year to say that this pandemic has forced us all to shift our work in some way or another. From how we engage with others and the community to the small yet important things like, do I get fully dressed today or just wear pajama pants all day? But more seriously, we don't have a crystal ball or know how things will or won't change in the coming months. So moving forward, we have an obligation to continue to be ready to pivot at a moment's notice. The community is counting on us to do so, and maybe, just maybe, we'll be able to meet in person for the very first time in the near future. For now, thank you all for allowing us to share our journey, and we hope you enjoy the rest of this conference.
My name is Ariana Vaith. I am best friends with Linnea Sproles. We both graduated from the Milwaukee Institute of Art and Design in 2017. And I am a figurative painter who depicts people who are generally very close to me and people who I hold to high esteem. When we were invited to be on board for this project, the motivation for this piece was definitely to highlight a lot of the people, or just not even a lot of people actually, because it's only 4 pieces, to highlight just 4 people who we could see, these Black folk in our community who've been doing so much labor. My models in particular, I had seen them just being leaders for a lot of the marches that were happening in regards to the death of George Floyd, as well as many people who have lost their lives due to police violence. And it's all connected. These people are volunteering. They don't have, they're putting their time into something that is essential, something which is our rights to live. And I took this opportunity I wanted to highlight the joys within these people's lives, that they often are sacrificing because to do this work. And those joys are, they come from being able to call in with a friend and make sure someone is okay. And even though you're socially distanced and they're physically distant from each other, those emotional connections never leave, I think. So I chose Zed Kenzo, who is a rapper, a very talented musician who, in addition to being one of the first backline recipients, was one of the leaders in the Black is Beautiful bike ride. And so they are the smaller image over here, and they are on a phone screen to symbolize they are having this communication with the other murals. Like, they're all, in my mind, they're all kind of speaking with one another. And the mural behind me, this is Lady London, with the mask and with how people are kind of framed, like whether that be in a computer screen or a phone screen, like, and also like the company of masks and different ways that we are taking care of ourselves. We let that kind of be the door to who we needed to focus on the image and who the people were, and who the people are, because they are here and they're continuing to do this thankless work.
Hello, my name is Stacy Young, and I'm presenting on behalf of my partners, Jean Gerasi and Melinda Hughes. We're at the Benedict Center in Milwaukee. Today, I'm going to talk about the Sisters Program and how our partnership maintained community-based outreach and engagement during the COVID-19 pandemic. So a few objectives for the discussion. One, I'll describe the history of our partnership to address the fundamental needs for women. Also, I'll discuss how our partners collaborated to appropriately identify women in need of healthcare and shelter. And finally, I'll discuss our communication and outreach strategies that we've utilized, particularly in the last year. So the women that are a focus of our work primarily are those that are engaged in street-based sex work and therefore at high risk of exposure to violence. And this remains a highly taboo topic and forces women to the margins of society. And in particular, women that are engaged in street-based sex work are often dismissed, and they're a very vulnerable and underserved group that experiences histories of trauma and loss. So for the focus of our collaboration, we're very much interested in addressing underlying trauma. And as a result, ongoing communication and engagement are critical for our work, especially for those that are in most need of the basic needs, such as housing and shelter. So our partners include the Benedict Center, which is a community-based organization in Milwaukee, working primarily with criminally justice-involved women. Impact was a central resource and service and access point for residents of southeastern Wisconsin. The Southside Organizing Center, which is a neighborhood-based organization focused on the development and sustainability of Milwaukee's near Southside neighborhoods, the Milwaukee County Housing Division, and the Medical College of Wisconsin. The Sisters Program is grounded in a harm reduction model. So we seek a paradigm shift in the ways in which law enforcement, service providers, and healthcare practitioners and the public respond to women in street-based sex work. So rather than situate it solely as a criminal justice matter, we like to situate it as a public health issue in order to address the underlying issues related to gender-based violence, homelessness, substance use disorder, and relevant examples. So this is grounded in the idea that since multiple complex issues can lead to criminal activity, it takes multiple programs that we need to offer in order to fully address women's needs. So the Sisters Program serves over 400 women per year, and we focus on two areas: street outreach and our drop-in centers. So the street outreach workers will talk to women on the street and focus on building relationships and encourage them to come into the drop-in center, where they're able to get crisis management, safety plans and respite, case management and wraparound services through our collaborations, and also educational and support groups. So we have two driving priorities for our work. One is that achieving health equity requires a system-wide response using a harm reduction approach, and also the importance of meaningfully engaging people and partners in our work. So we've engaged in a number of communication strategies over the last year. One of them was participating in the 3 o'clock with SOC, the Southside Organizing Center. SOC is not only finding ways to communicate with residents on social media, but their community organizers also attend our community engagement committee meetings, and they take information back to their neighborhood leaders. The community forum was held weekly, then bi-weekly, and now it's being held monthly, and it airs on Facebook Live and is then posted on their YouTube channel. And this week, Wednesday, we'll be presenting for the first time at the Milwaukee Police Department District 2 Crime and Safety Meeting, using a socially distant format and wearing masks at the local high school. And we're also engaged in stakeholder meetings and committee groups. We've been doing that using Zoom and Teams in the virtual format on a regular basis. And in many ways, we think this actually increases attendance because it's easier than for our partners. And finally, the Benedict Center website has been significantly upgraded, as that is our window to the public. Our outreach and engagement efforts have been ongoing even in the last year. Our communication with the Sisters participants was aided by providing them cell phones and staying in touch to ensure their safety. And we also modified and continued our outreach in drop-in centers following safety protocols. And telehealth measures were also utilized with our case managers with Sisters participants. So all of these communications and outreach efforts were to ensure that we're able to stay in contact with the women that we serve, and also across our partnership. And we've seen great benefits in doing this. And finally, we would like to acknowledge the Advancing Healthier Wisconsin Endowment at the Medical College of Wisconsin for funding our ongoing work. Thanks for listening.
Hello, my name is David Nelson, and it is a joy to be here. And today I'm joined by my friend and colleague, Yvonne Greer. I'm so glad that we can spend a little time talking about our project that we did together. Our project was a CDC-sponsored grant called the 1815 grant. And the 1815 grant supported chronic disease prevention, especially type 2 diabetes and hypertension. We just completed a 6-part series called Back to the Kitchen with Yvonne Greer, registered dietitian and nutritional consultant for healthy eating. It was a lot of fun doing those show series with you, Yvonne, and we had to make some pivots due to the pandemic. Can you tell us a little bit about what we accomplished?
Yes. Originally we had did the Days of Learning as a conference that we would do, and we would have different breakout sessions, and I would do some type of interactive educational or food demo so that people can develop skill building. So as the pandemic came along and we wanted to look at how are we going to be promoting diabetes and chronic disease prevention efforts, we looked at developing a podcast series, which you were gracious to be the moderator. And then we decided to do a 2-part kind of program that included a video segment of me in my kitchen, really doing some recipes that are in the curriculum that we had developed called the Back to the Kitchen Healthy Cooking Curriculum. And then also as part of that, that presentation, we were going to then have some of the community champions come on board. So first idea was to use a different platform to do skill building where people can actually see delicious and nutritious recipes being made, look at the ease of cooking from scratch, and then also be able to showcase healthy cooking techniques and also simple utensils that people would need. We did find out from previous work that there was a lack of skills in cooking that needed to be rediscovered. So that was prime for this type of a video segment to be done, but it had to be transitioned to my kitchen versus a live program. I wanted to mention that the episodes were based on the My Plate. So each segment would take one segment of the My Plate. So back to the kitchen with fruits, with vegetables, with meat and dairy and that type of thing. So those segments was able to provide a platform for the grassroots individual to come on and to share their voice, their motivation and experiences in working with the community to promote health and wellness.
I think it's important that we talk about the cultural exchanges that were going on. You told me an example. Can you share that with our audience, please?
Yes, the example was in our first program, we highlighted G's from G's Clipper, and he has a health center that has been developed in the barbershop. And it's very important that understand that African-American men have different trauma and different trust issues with the medical profession. But having that clinic right in the barbershop helped to break down those different barriers, and people, men are now talking to their barbers, getting health screenings right there in an area that they are very comfortable in.
You know, we always say meet people where they are. Yvonne, could you talk a little bit about some of the other foundational issue that you thought was really important in this series?
I think that, you know, creating safe spaces for people to be able to share their knowledge, skills, and to learn from each other, both from the clinical side and from the community side, is just so important to happen.
Yvonne, from this 6-part series, can you tell us what mattered most to you?
What mattered most was the idea that deeper relationships and connections were made with the community and within the community champions. Some didn't even know the other ones that was on the program. And so we have developed a richer and connections between all. What mattered most for you in doing this series?
Thanks for asking, Yvonne. I think for me, and I've really appreciated our relationship over the years, that we have to make sure that we always have the perspective of the community we're trying to reach. We especially want to highlight the assets that exist. Too often those assets go unnoticed, and so we need to do what we can to spread the word for these. Thank you, Yvonne, and thank you for joining us today at this brief presentation.
Hello, my name is Charlotte Running, and I'm a project manager here at MCW. My role primarily supports the Office of the President and the Office of Communications. About a year ago, in the spring of 2020, MCW was called to connect with and support the community in a new way. As the COVID pandemic swept the globe, it was immediately clear that it was not impacting all parts of the community equally. Black and Latinx communities in Milwaukee were getting hit much harder than other populations. Immediately, MCW began work to address this. A cross-functional team was formed called the Community Communication Initiative. This team included basic scientists and clinicians, community-engaged researchers, communication experts, and PR and media specialists, and I was fortunate to work as project manager on this team. Our stated goal was to provide accurate, unbiased, apolitical information on COVID to the communities who needed it most, and to ensure that our work was guided by the needs and voices of the community. We were clear we did not want to tell people what to do, but rather we were providing them the information so that they could make informed decisions themselves. The key deliverables from our work were infographics and flyers in 3 languages, English, Spanish, and Hmong, a detailed website solely focused on community-based COVID information, virtual community town halls hosted in partnership with individuals from throughout the community, including County Executive David Crawley, Dr. Tito Izzard from Milwaukee Health Services, and Dr. Maria Elena Perez from the 16th Street Community Health Center. And we used a variety of channels to share this information. So we partnered with faith leaders and business leaders. We hosted webinars with community organizations and businesses throughout Milwaukee and the state, and some national as well. We worked with social media influencers, had targeted websites and ads, and developed a robust media plan that targeted local news outlets like the Milwaukee Neighborhood News Service, which is a news service that primarily serves Central City, Milwaukee, and Nyanjong, Milwaukee, a Hmong language news station, and ultimately reach national audiences as stories were picked up by larger news outlets. Overall, we know that we reached upwards of 195,000 people through the webinars, over 10,000 through YouTube and podcasts, over 1 million through Instagram and Facebook, and over 95 million through earned media. While we can't say for sure that getting this information out reduced the spread of COVID, I think it's reasonable to say that in a time of significant misinformation, reaching that many people with accurate, truthful, science-based information had a positive impact. And this was only possible through extensive community engagement, outreach, and the community's willingness to partner with us in new ways. We, as a team and as an organization, learned a lot from our community partners in terms of how best to approach communication with them and how to most effectively reach traditionally underserved communities. The 5 guiding principles for communication we found through this work were: first, to let the community's needs guide you. Listen to what they're requesting and bring the scientific information that we have, but let them and their deep knowledge of their own community guide what will most benefit them and the information that we provide. Second, stay open to feedback. Engagement with the community was a constant learning process, and there were numerous occasions where we had to pivot, redo work, and apologize when we missed the mark. Our willingness to reassess and try again built trust and respect between MCW and the community. Third, meet the community where they are. This means physically, so actually going into the community, partnering with churches, grocery stores, workplaces, and other nonprofits where the community already is, rather than expecting them to come to us. And figuratively as well, so considering language barriers, ability to read and at what level, cultural differences, access to internet, etc. Fourth, acknowledge that the community is not a monolith. The Black community isn't, the Latinx community isn't. These are diverse, culturally rich groups, and the best tactics to reach them will vary by neighborhood, age, religion, cultural identity, gender identity, etc. Fifth and final, move at the speed of trust. This is language that I picked up from a partner of ours in the Thrive On initiative, Piper Anderson, but it holds true in all of our community settings. Moving at the speed of trust means that we need to take the steps outlined previously over and over without expectations or pressure. These 5 guiding principles helped our work be most effective in connecting with the community and has continued to be applied in our community communication efforts not related to COVID as well. They've provided a foundation for our messaging as we go forward and continue to build our relationship with the community.
Thanks everyone for your comments as well. Really, really powerful, everything that everyone was touching on. I just wanted to quick mention some of the strategic goals for the Office of Community Engagement as we move our work forward into the coming years. And that includes implementing a dashboard for tracking our activities across the institution, developing workshop series for our students and other learners, growing our mentoring network and capacity building workshops, and also dissemination, not only in academic circles, but in many different community forums. So any ways that you can think of to further enhance the work, please feel free to keep sharing those with us as we grow in our activities. Next slide, please. I just wanted to make a quick statement about our MCW President's Community Engagement Award and congratulate our 2021 awardees that are listed here. I hope you'll be able to join us to celebrate this year's awardees on Friday, June 11th. You can scan the code to register, and I believe a registration link will also be provided in the chat. That's Friday, June 11th from 11 to 12. An outstanding group of awardees this year that we are really happy to acknowledge with President Raymond. So thank you in advance for joining us for that. And again, congratulations to the awardees. Next slide. And our final slide. Thank you for joining us. A special thank you to the Office of Community Engagement staff, to Erica, to Kelsey, Christine, and Sarah, and Maya for just outstanding work pulling this together and making it seamless. It's just phenomenal, and it's a joy to have all of you on our team. And thank you to Bryan and Leslie and David and Zeno as our panelists for today and sharing all of your perspectives. And thanks to our all of those that joined us today and sharing everything that you did and speaking into this work and walking with us in this way. You have our email that's listed here on the screen, including our online presence, our website. So feel free to look there's going to be a synopsis and recording of this event coming soon, so watch for that. And you can also scan the QR code on the screen to provide feedback to us, and you'll also get a link via email. So thank you in advance for joining us. Please stay well, and we look forward to seeing you at our next event and convening again soon. Be well. Goodbye.